Thank you guys for joining us here. My name is Dr. Mena Ibrahim. I'm one of the foot and ankle surgical residents at Inglewood Hospital. This is my colleague.
I'm Dr. Mohamed. I'm also internal medicine at Inglewood Hospital.
All right. We're really excited for you guys to be here. We're going to talk to you guys about a topic that it's in my world mostly. Since I am a foot and ankle pediatric resident, I see this a lot. I deal with a lot of diabetic foot, and we will be discussing about some tips and pearls regarding about taking care of your feet, as well as those people who are at risk of having diabetes, what to look out for and how to take care of your foot, so prevent any medical complications or problems later down the line. Okay, so my colleague will first talk to you guys from her perspective, and then I will discuss about from a podiatry perspective what we deal with, how we can help you with, and then I'll give you guys a little live demonstration how to check your foot, how to do like a quick foot check at home, so you can always keep look out for yourself, and then we'll conclude with any quick Q&As. How does that sound? Right?
Good.
All right.
Okay, before I start my presentation, just would like to ask if anyone has diabetes in the room.
Right.
Okay. Any of you encounter complications secondary to the diabetes, like any complication? Like like affecting your eyes, your kidneys, your feet? Anyone with neuropathy? Your feet. Okay, can you share your story?
About 2 weeks ago, the pinky on my left foot, the nail turned black.
Mm-hmm.
And Google doctor says it might be a sign of something.
Yeah.
Okay. Okay. And what did you do?
Nothing I can do. I have a podiatrist appointment, but it's not for weeks.
Oh, okay. Sounds good. Maybe she can be a good example for demonstration. So yeah, basically it's gonna be our main topic. It's how the diabetes affects your feet. So why this is important? Because basically one of the most common complications of diabetes it's the diabetic septic foods, which can lead to unfortunately losing a limb, and can also increase the mortality secondary to diabetes. This is why this is very important to know how to prevent it and how to deal with it. Okay? Limb or leg. Limb. Yes. Okay. So why diabetes affect the foods? Any ideas? Like why diabetes can lead to complication in our feet? Okay, perfect. Poor circulation, because basically diabetes affect the blood vessels, plus uncontrolled diabetes and uncontrolled sugar level can affect the nerves. So it can lead to loss of sensation in the feet. Plus diabetes cause decreased immunity. So basically, let's say someone get injury and then it gets infected. The infection is not going to be as same as person who doesn't have a diabetes because of the poor immunity. So poor circulations, poor nerves, poor sensations, and then decreased immunity. Okay? This is why diabetes is very bad for the feet, especially with poor care and poor control of the blood sugar, basically. So this is just general statistics that 25% of people with diabetes can develop foot ulcers, and then at least I think 75% it can lead to amputation, right?
Yeah.
This is what we talked about. So we need to know what the early signs that we need to be careful before like having these complications. So you said your toenail became black, right? So this is one of the early signs that we need to make sure that we when we have it, we see our physicians immediately. Okay. Other signs like decreased sensation in the feet, and then tingling sensation or numbness. Other signs, redness or color discolorations in the toes or in the feet generally. And then we have also the ingrown nails, which basically when we cut off the nails, there is a remnant part that can be left over, and then it can be ingrown nails. So this part, if it stays for a long period of time, it can cause infection, or it can be a needle of infection, basically. Okay, I think Mina will talk more about this, right?
Yeah, the infection part.
Yes. And then if there's any injury that became like having pus or foul smelling, this is also one of the signs that's warning for you to go to see your physicians immediately. Okay. Any question regarding this so far? Sounds good. Okay. So, among the diabetic patients, who are the people who are high risk of developing diabetic foot infection or diabetic septic foot, basically? That's what we call in medicine. People who have very poor control of the sugar level. In other term, it's like very high A1C above the 7. Okay. People who are smokers. Let's say, God forbid it, the diabetes affected our vision, so we cannot check our feet on daily basis, or we cannot see. And then people who have already foot deformities. Diabetes can also cause like alteration in the anatomy of the foot. So if you see people who have like long-standing diabetes that are not controlled can develop like foot deformities. So this foot deformity is not aligned with the shoes that we wear on daily basis. So it can cause also it can increase the risk of developing diabetic infection or injuries or ulcers. Why I ask you about if you develop any complication regarding diabetes, because if you develop, basically statistics says if you develop one complication secondary to diabetes, it can predispose you to developing another complications. So if it already started affects your eyes or your feet or your kidneys, there is high chance it can lead to another complications. So people who has kidney disease secondary to diabetes, or have retinopathy secondary to diabetes, or have neuropathy secondary to diabetes, they can have higher risk of developing diabetic septic foot or diabetic infections. Okay. Smoking. It's like very high. If they're very like one of the most important risk factors that can increase your risk of developing diabetic septic foot or infections. It affects your vessels and it weakens the immune system, and then it causes poor healing if you develop any injury or ulcers. Sounds good so far?
What about drinking also?
Yes, yes. Bad habits of in general, yes. So, what should we do if let's say I'm diabetic? What should I do to keep my feet safe? Any suggestions?
Wash at night.
Wash at night. Okay. Mhm.
Always look and take care.
Mhm.
Pay attention to your foot.
Yes. Perfect. And what did you do?
Wear the right shoes. If you don't have it.
Okay, sounds good.
Or visit the doctor.
Yes. Yes. So you said washing feet, right?
Yeah.
So even the washing, it has to be in certain technique. So first, avoid warm or hot water. You have to use the regular or tap water. Plus, after you wash your feet, you have to keep them very dry. Okay, like
Lukewarm.
regular temperature. Yep. Plus, if you want to do any moisturizer, avoid putting moisturizer between your nails
Toes.
or between your toes, basically. Okay, so because basically the spaces between your, sorry, I'm gonna just show you. Yeah, so those spaces are very like they're very moist by themselves. So without putting any moisturizer, they are very moist compared to the other part of the feet. So let's say you wash your feet and then they are still like very not really dry, and then you put the cream here. That's gonna make them more like moist, and this can predispose to breakage in the skin in between. Okay. Yes.
The space between the toes they can trap fluid very easily. And you know when you take a shower and your skin gets a little frail and soft? Now imagine when you're putting moisture between your toes, but then you're not really washing it out or anything, you're putting socks. And you know, if you're walking around or running, your feet sweats too, now you're adding more moisture. Now you're causing that skin in between those toes to kind of break down, and then you can develop maybe even like a little blister or a cut, and then that can develop into a wound. And it's right next to the toes, which can affect the toes too. And if you're diabetic, your immune system is already kind of weak as well. Blood flow is already at risk.
Cause fungus?
Yes.
It can also cause fungus too.
It can
yeah.
cause fungus.
Yeah. So that is one of the main reasons why we say like try to avoid something like a lotion that contains a lot of like moisture in between your toes, because then that will stay there more and cause it to be breaking down weak and cause complications as well.
What about Vaseline?
Between the toes, that's the same thing. Anywhere else around the foot, it's fine. You know, around the ankle, the top of the foot, the sole of your foot, that's all great. Between the toes, Vaseline will make it smooth, but then if you usually should wipe it off. If it stays there too long, that can break it down the skin.
And even when you wash your feet, just make sure that the spaces between your toes are very clean. Yes, and dry. Okay.
What about underneath toes? They say you can like toes underneath, not
Like-
inside.
Yeah.
Like the ball of your foot.
Yeah, don't do it.
Any areas of creases, try to avoid putting a lot of moisturizers in the space. Okay. What else? And then we said when you trim your nails, just try to trim them like straight. Don't go to the corners, because this is what can cause the ingrown nails basically. And then you said one of you said check your feet on daily basis. This is very important. If you cannot see clearly, try to get someone to help you with checking your feet. You have to check them under like very good light, sunlight maybe, and then try to check like the whole foot, like between your nails, between your toes. Try to see if you have any decreased sensations, any ingrown nails, any ulcers, even if there is simple like a breakage in the skin. Try to be careful with that. Okay. What else? And then the shoes. Okay. You have to make sure that the shoes that you wear every single day is very comfortable and it's aligned with your anatomy of the foot. We mentioned previously that diabetes can cause change in the anatomy of the foot, or it can cause foot deformity. So make sure that your foot that we wear is very comfortable and not causing any like stress on your feet. Okay.
So a common example, like that we would see in our offices, is, you know, as ladies, you guys would like to wear high heels, like fancy gala and stuff like that. But those heels kind of puts a lot more pressure on your toes, and around that toe area, there's a band that usually clumps all your toes together, and your foot is usually not meant to be squished too much. And when you're pushing your toe too much on one side, it can cause what we would see like those bunions, and that causes that rubbing and like irritation later on. So we say when you're getting shoes, like try to avoid like high heels, high arch, and then always get like a toe box that's just wide enough for your toes. You don't want to go to where it's the very end where the shoe is kind of pointed like a triangle, because your foot is never shaped as a triangle. Your foot is more shaped like kind of like a hand, kind of like a good wide shape. So you want to get like, usually a common thing we would say is like half size bigger. So if you're 11, 11 and a half. If you're 7, 7 and a half. That gives you enough space in that toe box so your toes are not too cramped. Okay.
The fashion ones are the ones that are pointed.
Yes,
Yeah.
unfortunately. Anything.
Well, that's what they say. Beauty is pain, right?
Yes. Anything that can makes you uncomfortable, just try to avoid it. And one very important point is never, never, never walk barefoot. Never. Never. No, because imagine if you're walking in the grass and then there's like a nail or something that goes in.
If you don't feel it, if you don't feel things on the bottom of your feet, you won't know if you're stepping on something you shouldn't be. Well, it depends if you know what's on the ground.
Yes.
So usually, like even just like a socks, but even then, I can even go and say like, when you're walking barefoot, sometimes it's good just to kind of stretch out the muscles in the foot and everything. But when you're walking barefoot, you're putting more friction on the skin of your foot, and that's what we call calluses, where it's like your skin kind of responds to like, hey, there's a hard environment over a soft part of our body. We need to reinforce it by building hard tissue, which we call calluses. And then those can even lead to developing wounds underneath the callus, and you would have pain when you're walking on it because your body's building a helmet over something that your body should really have like a fat pad, and then you're developing more and more of that callus, and that could even develop. Some people would say like it feels like walking on pebbles, even if you're walking barefoot or anything. But with those calluses, makes you feel like you're walking on pebbles. So we usually say like even at home, like I would wear like socks. It's a cushion, and it's at least for diabetics as well. It kind of gives you that one extra layer of like protection, just in case if there's something on the ground, or if there's something hot and you don't feel it, and it gives you also some grip as well.
Yeah, and basically that. Okay, go ahead.
No, I just wanted to go back to, you were saying that don't use hot water or cold water. So what happens if you use too hot or too cold?
So it's not too cold, just like regular temperature water, because too hot can cause also breakage in the skin. Or cause like burn basically, or blister that you might not, like it can cause like infection at the same time. Okay. Just to avoid like burns in the skin or breakage, but you can use regular temperature or tape like water or whatever, but basically no like very hot showers or saunas maybe. Try to avoid those. Anything that can cause breakage in the skin or burn, try to avoid it.
Like very common, I see people coming when they came from like a tanning bed, right? And they have their either foot resting in a certain area or something, and then they just come out with a burn, but they wouldn't even notice until they see when they're walking some blood on their footsteps. So that's when they really notice that there's something. So same thing when you're washing your feet. We say don't use hot water because you might not know how hot the water really is.
Yeah.
And then that can cause blisters, and you might not even see that. Cold water too, you don't want to be too cold where you can give yourself like frostbite, or making it too cold where it damages the skin as well.
Oh, so that's because you don't have the same sensation.
Exactly.
You have loss of
Yes.
True.
okay.
That fine touch, yeah.
So basically this is the whole idea. You have less sensations, and then you might not see anything whatever happening in your feet. And then even if it's very simple, like a scratch in the skin, it can be infected, and then you don't know how far this infection is going. So it's not just simple stuff that you see it from outside. Some infection can goes up to the bone, and then this is why we're trying to avoid.
I have a cat. I have to stop playing with my cat.
Just make sure as long as she doesn't bite you.
She tries.
So you're afraid because you walk around barefoot, or just try to put simple socks as he told you. Just simple socks. You don't have to put your sport shoes or your high heels. Just regular your slippers. It could be protective, or any socks. You know what? Yeah. Don't stop playing with it. Yes. Okay.
Good questions.
What else? Talked about this. Yes, we talked about this. Choose well-fitting shoes. Avoid high heels. Put your socks. Make sure that your shoes is very well-fitting. Again, and again.
What?
The shoes to be well-fitting to your.
They're not too loose, and they're
Or too
not too
tight.
tight.
Yeah.
And especially if you see like a podiatrist, if you're diabetic and you're taking medications and it's controlled or slightly not controlled, we also can prescribe diabetic shoes. So these are they're getting a little bit more fashionable.
Yeah. Yeah.
We've been always using New Balance, but now New Balance is becoming now the trend. So now it's now in fashion. But these diabetic shoes are now built in with more cushion. Places where we notice so your foot is usually have that normal anatomy of a fat pad right where your heel is and right the ball of where your foot is. But usually as you age, and even with diabetes, you lose some of that fat pad underneath. So that diabetic shoe can give you that cushion as well, where we give you that extra cushion to prevent putting too much pressure where it shouldn't be, preventing that callus, as well as preventing any ulcers, any wounds developing, and even kind of help correct some of if you're a flat foot, we can sometimes able to kind of correct that as well. If a high arch, if you walk more on your toes or more on your heels or more on the outside, those shoes can be have a custom orthotic built into it to help with that too.
Mm-hmm.
You just mentioned fat pad, so do you see that decreasing with age, or is the fat pad just decreases over time, we wear it out?
Well, with age, usually we've seen it with age more. With diabetes, smokers, it affects more of that neurovascular, so the blood flow and the nerves, which what kind of feeds the fat cells, and which when you have that compromise or like that loss of that easy highway of the blood flow and the nerve sensation, that kind of makes the fat pad kind of deteriorate quicker.
So the Dr. Scholl's little pads you can pick up in ShopRite?
Those are like for the general public. You're just like you get custom like clothes and stuff. Those are not made. Those are just made for the general public. Not everyone's foot is cut a little bit different from the other. Some people have more like flat foot. Some people are like not too flat but not too high, or they have more pain on the outside. So like Dr. Scholl or like these over-the-counter orthotics can be a good first line of kind of giving you that extra comfort. But if you really want to get that 3D, like that extra, like that mold of your foot, to get the actual anatomical structure of your feet, to be able to target where exactly to distribute that pressure. What we do is like there's some orthotics where we bring the floor to the foot instead of the foot to the floor. So for example, if your big toe doesn't reach the floor too much, right? Those regular orthotics from the counter doesn't really address it. They just address the general population. Those we can do that. We can even put a bar or like an extra pad, like a metatarsal pad, stuff like that, to like we modify it based on like tailored specifically for you, kind of.
It's most balance shoes, sneakers.
Yes.
Yes.
And those can be really tailored, and we even ask you what kind of shoes do you wear, what kind of work do you do, so we can even give you like extra pairs, and then those pairs have specific types. Like some of them might be a little bit harder, so that way if goes into whatever shoe you want. If you're more athletic, those athletes like to have a little bit thinner, so that way their shoe you can get it fit in and it's more flexible. So we take in consideration your daily activity. What do you do? What kind of shoes do you wear? And we accommodate with that with the orthotics.
Mm-hmm. Sounds good. Yep. And then want to see your physician in case there is any concern. So basically, what's your name again? Pet. What Pet? This is the right thing to do. So whenever if there is any injury, if there is any blister, if there is any, if you see like your foot color changed or your toe like nails color changed as well, if any pain, you have to see your physician. And even before that, most like diabetes has to see at least like podiatrist once a year, right? For check.
It depends on how severe or how critical it is. Like if they really don't have any losses, like they have loss of sensation, like they really don't feel, we can even go up to every 3 months.
Mm-hmm.
Some we see every 6 months. And then just like if it's just a very routine and they can still feel and everything, maybe like once a year too.
Yes. So you have, yes, go ahead.
No, I was just gonna say, but the condition that she says she has, that's not like emergency, like get to the doctor right away. She says that she's gonna see the doctor, but it's a few weeks away. She doesn't have to go right away and say, okay,
So,
this is what I
Like
see.
pinky on my left foot and turn black.
mm-hmm. So we need to, so we cannot decide. You have to do examinations and then do other stuff to make sure this is not an emergency. But if there is no pain, if you don't have any fever, if you're, let's say, if your feet is not swollen, if there is no like redness, there is no pus, it can wait. But you have to, if you can push it to get earlier appointment, that would be better.
Is there any words or something you should say when you're having something change in your body to say to the
Yes.
person making the appointment?
Of course.
To know the urgency behind
Yes,
it?
yes. Let's say your feet is swollen, like very red. You cannot walk with your foot, and then if it's not just the foot. If the swelling is going up to like your legs or your knees, and then if you see any ulcer that has pus coming out, or if you develop like other symptoms like fever, you're out of breath, you're confused, maybe can be indication of that's the infection, not just in your foot, but it went to your blood. So this is like sign that you have to be careful and then you have to go to the emergency department immediately.
I am diabetic, and I see my doctor every 3 or 4 months
Mm-hmm.
for the A1C.
Mm-hmm.
So my question, should I be going on a regular basis to the dietitian? I go yearly to the doctor along with my every 3 months checkup.
Mm-hmm.
So I don't have any problems so far, I think with the foot. But should I see a podiatrist on a regular basis also once a year or every 3 months, just like I go to the doctor?
I would say if you have any decreased sensations or numbness or any signs that can indicate you have diabetes neuropathy, you have to be referred to podiatry because there's other extensive. I think she should be referred, right?
Most depends on the insurances. With Inglewood, I think you can go within the network and you can make an appointment directly with the Inglewood podiatrist. But I would say talk to your primary and say that you've looked into this and you would like to see a podiatrist, and they would either they would tell you like, yeah, you can just whichever one you want, or they can give you a referral based on whatever your insurance plan is.
I don't want to wait until I take it.
And that's really great. That's like being proactive and staying ahead of it. We have patients that they do that, whether they knew about podiatry or someone referred them to them. But if you this is the point of the talk, is bring exposure, bring awareness for you guys. So if you're aware, like, okay, like I know what I have, and depending on what your symptoms are, you can easily be like, ask for referral. And then depending on how severe, so the severity it is, maybe it's once a year, maybe every 2 years.
Yes.
You just get like a routine check with your foot doctor, and I'll go over like what you can do at home to check for yourself as well, and then what we do as a podiatrist check out in the office as well, and how to make sure everything's going good. Okay.
But I would say at least once, like just to make sure that there is no concerning stuff going on.
At least once to get a baseline. And
Yes,
follow
exactly.
from
Yeah,
there.
yeah. And then you can do the regular check at home and everything, but at least once to know your baseline. Okay. Talk about this, and then basically, this is just like how to prevent diabetic foot or diabetic septic foot. First, control your diabetes. This is like the first for everything. Control your diabetes, control your diabetes. It's not just gonna prevent your feet, it's gonna infection, but it also will preserve your vision, will preserve your heart, preserve your kidneys. So control your A1C, stick your medications, see your doctor regularly. Lifestyle. So you said you play with your cat, right? So this is like activities. Try to exercise. Try to do the minimum activities that you need to do to make your circulation going on. Yes, exactly. Walk a lot. Do exercise. Smoking. No. Yeah. And then if you see any concerning signs in your feet, see your physician immediately. Okay. So just to wrap up, before Mina start talking about or you want to start talking now?
I can take over.
Yeah. So basically, check your feet, and then control your diabetes. Physical activity. Have appointment with podiatry at least once in a while just to check, and stay healthy. And then I can take any questions so far before.
Okay.
Mm-hmm.
What are a normal, a person without diabetes, what A1C levels? That was pre-diabetic, whereas just 7 is 10.
So if someone doesn't have any diabetes, it should be less than 5.6. From 5.6 to 6.5, this is when we say it's pre-diabetes. And then above 6.5, it's diabetic, right? But then even for diabetes, let's say from 6.5 to 7, this is like, we can say it's acceptable. But anything above 7, this is not well controlled.
Pre-diabetic is reversible.
With control, lifestyle, yeah, it can be reversible.
What effect does diabetes have on the heart, especially if the heart has trouble?
So diabetes overall affects the circulations. So it goes like with other issues, like if you're diabetic and have high blood pressure, all this can affect your heart. We say by calculation something called atherosclerotic cardiovascular disease risk. So it has the age, the gender, if you have diabetes, how well is controlled, if you have high blood pressure, if you're on medications, if you have other, let's say, circulatory disease. This can increase your risk of having like cardiovascular diseases as well. So anything that can affect your circulation can affect your heart, basically. Smoking as well.
Okay, thanks. So I'm not going to go as much in detail because my colleague has already kind of give you guys a general overview, but I'll go more focused on what I can provide information regarding from a podiatry perspective. Okay, so your feet deserves attention just like any part of your organ, right? Just even though it's the farthest part of from your view, it still needs it's very important. And as you can see, there's like across the country, the darker the blue, the more you see people have either neglected or not been able to see a foot doctor soon enough, where the risk of amputation in that area is really high. And so really, your feet is really important. That's what makes almost depends on your lifestyle. You know, some people can't work without being on their feet, and so really, like the feet is really what makes you have what we say like the freedom to walk around, not being able to be limited to certain places, be able to work and have a like living. And how does that affect? You know, just as my colleague said, that peripheral arterial disease. So that the blood flow, as the arteries go away from your heart, the arteries get smaller and smaller, right? As well, like your toes are the smallest part. And so those are the easiest where they can kind of get clogged by that extra sugar that kind of flows through your bloodstream, okay? And usually that's the first signs when we see like diabetic patients, where what we call the gloves and socks kind of distribution, where your hands and feet starts to get affected first by the nerves. They get that numbing, tingling sensation, right? You might notice that some of your the hair on top of on your foot or in your hand that starts to go away as well. That's because of the blood flow kind of decreased. Because if you're the artery, think of the artery as like a highway. When it gets too much clogged, there's less traffic going through. So if there's less traffic or less blood going through that very already narrow highway, narrow blood flow, whatever else that's at the end that depends on that blood flow kind of gets a little starved out. The skin kind of gets a little weaker. We call it like having shiny skin. You know, your skin is it loses elasticity a little bit. It gets a little rigid, a little smooth. The hair that's usually grown from it that depends on blood flow, that kind of goes away, and you start to notice it's just pure shininess. That's something that's what we at podiatrists, we take a notice of that right away. Okay, so that's how peripheral arterial disease kind of affect from the very end of like your feet, your hands, where that numbness, tingling, the nerve is screaming out that they're starving, or when we call it glycosylation, where like the glucose kind of binds to the ends of the nerve, the axons, and kind of ends that terminal, and that kind of causes that nerve to shoot out that little numbness sensation, as if like when you were like, if you remember when you like have your leg falling asleep on you and you have that tingling sensation, that's what kind of feels at the very tips of your hand and your feet. And then when you have those and you have that constant numbness and tingling, you won't be able to tell something different if you stepped on something too hot or not, because that tingling sensation, that's your baseline. Okay? And then that develops into what we see like a wound, and those wounds where if you don't have enough blood flow, right, that just welcomes the bacteria to come in, grow, eat whatever that's there, and then make that go down, down to a more serious condition where we would try to save as much as we can and try to do cleaning of the wound, but and your immune system is not able to fight as much, because just as there's not enough blood flow going there, there's not enough of that immune system being able to share that same freeway that's kind of trapped with all that rush hour of that glucose being blocking that bloodstream. Okay. Oops. So just like my friend said, like early signs and symptoms that you shouldn't ignore. So tingling, burning, numbing sensation. So you ask what kind of things I can ask to bring awareness of what's going on. If you notice that you have some tingling, burning sensation, that's consistent to something with the nerve. Your nerve is trying to warn you, tell you something that they're starving. Color changes. If you're noticing that your skin is turning more red or more blue, or is it turning more pale than it's usual, or like loss of hair, that's indication like you're not getting enough blood flow reaching down to the very far end of your limb. If you're noticing that your leg and your foot is just being swollen more, being more like red and warm, even if you notice something smelling that's not usually normal, you want to make sure that it's not something like there's not something inflammatory or poor venous flow coming back. If you notice, like I said, like having socks is a good barrier, but it also gives you a good sign and a warning, because you might not be able to notice anything, but when you can notice something when you have your socks off, you can kind of get a better view. And if you notice that there's spots of red or some kind of drainage, something smells through the socks, that can give you kind of a closer look what's going on. There might be a wound there that you might not be able to see from the bottom of your foot. Toenail changes. All right, your toenails also changes depending on on your circulation. So you can have what we would say like a really thick nail. Your nails might turn a little bit yellow. Those are what we call like fungal toenail infection. Okay, those can be treated in the office with like shaving it down, giving you medication, topical, or it's what we call like pin-like, which is kind of like a layer, like putting like a layer on the toenail every day. And it's very clear, and then we tell you like on a certain amount of time, like at the end of the week, you wash all that off, and you start a new layer, and you build that layer until the end of the week. That's another treatment. Sometimes we can even give you a pill based on how good your liver is. So there's other modalities and treatments, but only that can be treated in the office after we evaluate and make sure everything is good. And sometimes you might not even notice that. So those are some kind of the flags that you want to take care and be aware of. Okay. Any questions so far? Okay. All right. I feel like this is the best slide, if anything, out of this topic to look over, like to have and see. This is some tips to keep your feet healthy. All right. You want to check your feet every day. All right. You might not be able to have like a side mirror to hold, but most of us have phones that have that front viewing camera. You can always try to have that camera even zoomed in on your phone and be able to get a quick look. Use the technology to your benefit too. Washing your feet in warm, not too hot, like kind of lukewarm. You're trying to make sure that your skin also gets hydrated. You don't want it to be too dry, because then that gives that little like what we call fissures, like little cracks, dry scaly skin, right? And those can cause the skin to be too rigid. Where now if you move anything, it can make a cut. And then if you already have poor blood flow or you can't really feel, you won't notice that, and then leads into problems. So moisturize, like hydrate your skin as well. It's a really good idea. Just make sure not too cold, not too hot. Never go barefoot, even if it's inside. You never know like you might not be able to see something, or I see people like they dropped something, it broke. They thought they cleaned everything up, especially if it's a jar of glass, something in the kitchen, it breaks. You feel like you swept everything up, but you walk bare feet and maybe a glass gets stuck on the bottom of your foot, and you wouldn't know until it really gets jammed in. So it's always nice, at least even at home, have some kind of barrier. You want to always take care of that. When your feet hurts, it can really like throw your whole day off. Wear shoes that fits, and always wear socks in those shoes, because that is one way of preventing the fungal infection. Because the fungus in the toenails always like to be in a place that's closed, moist, and they can grow in there. So cleaning your shoe, like there's like those like Lysol sprays in the shoes, changing your socks, try to avoid wearing the same socks every day, because at the end of the day, those socks collect all that, like the sweat from your foot. You don't want to wear that again, just like you wouldn't wear the same shirt that you sweat through again. So treat your feet just like any part of your clothing. Trim your toenails, and I brought a picture of that up there, and also like I brought a little model of what a good safe toenail would be. Like having something that's not like a scissor to go and like, I know some people would like to go to the corners and try to really trim as much as they want, but that we call that bathroom surgery. So you're doing
What do they call it?
like bathroom surgery. Like you're doing like almost like a surgical procedure in the bathroom, because usually people trim their toenails in the bathroom, but sometimes you might go really too deep, and you might nick some like the side of the skin fold that's right there, or you might go a little too far and then you cut more than you should be, and then now you're bleeding in there, or you might not have cut all of it, and that little piece that might be way in the back is now be poking, and now you're left with something that's always constantly poking you on the side of your toenail when you're walking, and that irritates you. So something that's a little safeguard, where it already kind of has a pre-built in a little curve, and you're not going to be able to kind of really jam in to the corners, are a good practice to always have. Don't try to remove corns or calluses yourself. So just like I was saying, like when you're walking barefoot, you can develop that little hard layer of skin when your body's responding to extra pressure in certain areas. Don't try to rub too much and try to shave it yourself, because if you don't feel that much, or if you're always tingling and you're just shaving, you might go a little bit too far, and you're just opening yourself to like an abrasion and even a wound. And if you already have, like your immune system is already kind of weak, you don't want to make it even harder and then risk of like having like a superficial infection. And then lastly, have your foot checked by a doctor, podiatrist. That's what we do all day. We always check your feet, just so like we are comfortable just to always check. You're more than welcome to always come, make an appointment, and we will always check for your feet and go over certain points of what we're looking for, checking your nerves, checking your blood flow, checking your skin, as well as checking between your toes as well. We really give you that whole 360 package as well over there. Okay. So on that note, I'm going to keep that slide up. I can pass around some flyers of how to do an exam on your feet, and then I'm going to have one of my colleagues to come donate her feet for us to show you what an examination would be like. Can I have one?
You want one?
Yeah. No. This is just a copy for you guys to know what we look for and what you can also look for too. So it gives you a quick idea what are some things that the doctor looks at, so that way if you notice something, that you can even help us as well. Okay? So obviously the most important thing that a podiatrist will come and talk to you guys about is, when you're first meeting us, we're going to ask you, what's your medical history? We want to know what do you have, to build that relationship first, right? And one of the most important things, like in the first box, is we're looking for, like, have you already been diagnosed with some kind of nerve problems, like peripheral neuropathy? Do you have any cardiovascular problem, like a heart failure, or you had a stent or something? Have you had any cataract or any eye problems as well? That also gives us an idea as well. So that's in the first box. And if you notice in the first box, we also talk about your hemoglobin A1C. What was it? When was the last time you checked it? And if it's been 2 hours, we are good friends with the primary doctors as well. We would refer you back to them, or let them know, like, hey, we would like to have a new A1C check to keep track of how your blood sugar is. Okay. Then we go into the second box, is what anything that's going on. What have you have any current ulcers, any wounds? What's the current problem that you have at your feet? If there's nothing, you can just skip through that box. If you have pain in your calf, we want to make sure that there's no problems of like any blood clots. Those are most commonly found when you have like a pain behind your calf, and your calf will be warm to touch. Then we go to the foot exam. So we look at the first thing we look at is, so like for example, you come to our office and we're like, okay, you're sitting on a really high, comfortable chair. And we take a look at your feet, right? We compliment you at your pedicure and we say that's really nice, okay. And the first thing you will see, most of you guys will see us do, is we check for your pulses. We want to see how your blood flow is, all right. And we check up here, and we also check behind your ankle too. These are 2 points where we always check, and we sometimes even check on both sides just to compare, because sometimes one limb versus the other, there is sometimes a difference. Okay. Once we get the pulses, we want to check the nerves. We check on the skin itself, see if there's any cracks, any wounds, anything like that, any buildup of callus or anything like that, or any abnormality that we want to take a look at, right? And we say like, oh, a little too dry, you might want to put some lotion on here or something like that, okay? And we also look at if there's any hair growth, all right? Because if there is any hair, there's like, okay, there's good blood flow. Some people are just not they don't really have normal, like have natural hair, but then that's where we look at both of your feet. If one foot has a lot of hair and the other foot doesn't, then we're like, okay, this foot is starving more than the other, an idea, okay? So we see here like, oh, she has good hair on her toes. And we also, from there, we go through and like, okay, we just want to make sure that between the toes, there's nothing going on. And then we also press on the bottom of your toes, right? You be thinking like, oh, we're just playing piano, like a piano keys and stuff here. But what we're really trying to check is, just like your finger, when you press on it, it turns from white to pink, right? That tells us that the blood flow is returning back to the finger. Same thing with the toe. We're pressing on the toe to see it goes from pink to, like from white to pink. And we're like, okay, blood flow is really going back in. From there, we would tell you like, okay, can you wiggle your toes? Like, okay, nerves, muscles intact. Then we tell you to like, okay, push against my hand as a gas pedal, push up against push in, push out. This is all testing your muscles as well. Because your nerve, just as your nerves help with like innervating and letting you know if there's any pain, it also innervates the muscles too. So if you're losing the nerves, you're also having your muscles weak too, because the muscles only grow as much as the nerve stimulates them. Okay? Then we also want to make sure that there's nothing on the bottom of your foot, anything like that. We want to make sure behind your calf, there's no pain behind there either, right? We also want to look at your nails to make sure like there's nothing thick, it's not too yellow, it's not, if there's like anything black underneath, we want to make sure that if there's any trauma, is there any cuts between it? Is the nail too loose that we might have to remove it? Because if a nail is too loose, but we leave it intact, that can be harboring, it can jam the other toe, cause wound in it. It can jam into the toe and cause even, rupture the nail bed that we call. So this is the nail plate that we paint over. The nail bed is underneath the nail, right? So we check all of that and we're like, okay, looks good. And then we do a test. So a lot of the offices, what we have is like what we call like a monofilament test. This is like a 10-gram, like a pinprick kind of test. Doesn't really hurt. And even then, we would tell the patient, like, hey, what I'm going to do is I'm going to have your eyes closed, and you're going to tell me where am I touching you, right? And if just so you know that it doesn't hurt you, like if you give me your hand, I'm like, all right, I'm going to just enough to bend. I'm like, this is how it's supposed to feel, all right? So if you close your eyes for me, and then in that picture that I've provided, I have like some circles where we would point. These points are not random. Mm-hmm. These are to tell us every nerve. So you have multiple nerves, branches from different parts that innervate certain places. So you have one that only comes up in this middle area. There's one that comes and innervates right here. There's one that just in the middle right here on the side. There's some on this side as well. And then we have one in the back as well. So what we're doing, we're actually testing all the nerves. We're not just going randomly. So we're like, can you close your eyes for me? Tell me what you're feeling. Do you feel anything? And sometimes we trick you guys. We don't do anything we want to see. We just say yes or no, all right? And if you do feel anything, yeah, no, all right?
First toe.
And then you tell us which toe is it. And if it's both feet, we do the other one. It's like first on the right, first on the left, something like that. And then we go through across all. Okay, she probably missed one of them. Okay, all right. And so we go through, and there are 10 points specifically, all right? The big toe, the third toe, the little toe, and from the same of those three, you go through the ball of the foot of each one of these as well. Okay, so that's 6. One on the arch, one on the side where the arch is. All right, that's 8. One on the heel. All right, and that one nerve that only comes up here, that's 10. So there's 10 points that we would usually look for to test. There's other tests as well, like we would use this like tuning fork. It's like a vibration. We would hit it, let it vibrate, and we find the little bony part of your feet, and we put it here and tell you, do you feel it? Do you not feel it? And then tell me when you don't feel it anymore. And that tells us about the nerve. So your nerve doesn't just tell you about the pain. It also tells you about the vibration as well, right? If you're like an earthquake, you can tell it's a vibration. But also, another thing we would do is have your eyes closed, okay? This is down, this is up. Tell me which position your toe is. All right? So your nerve tells you that too. Like sometimes you don't even know, so you know where your hand is without even looking. That's what we call proprioception. That's another part of the nerve test that we also check as well. So the idea of when we're doing that physical exam, we're checking the skin, we're checking the nails, we're checking between, we're checking how anything hard, any callus, any corn, anything on your toes. If you have like a hammer toe where your toe is like really hammered up, we want to see, is it a bony problem? Like your bone is just really rigid like that? Or is it like a muscle or a tendon problem that's holding one side is pulling more than the bottom side. So those are all problems that like we would do in a physical exam just to check in the podiatry setting. All right. So again, like having a good nail clipping, yeah.
And so would you recommend doing the nails also? Because
In the podiatry office, we actually do your nails too. You're getting the full service when you come to podiatry.
but then